Now, let's turn to a more serious matter, the health situation this morning, because we're being told that the number of people dying from heart attacks has halved in just under a decade. Researchers from Oxford University say there was a 50% drop in the male death rate between 2002 and 2010, 53% drop in women. The rate of occurrence also fell, the number of people suffering an attack in the first place down by about a third for both men and women. Experts say progress partly due to better management of risk factors and some improvements in hospital care as well. Let's talk to a cardiologist who's got all the details on this, Dr. Iqbal Malik. Good to see you.
Morning.
Are you surprised at these figures? Because they do seem really dramatic.
They are dramatic, but actually there's no surprise here. For the last 25 years or so, there's been a very steady decline in the rate of heart disease and also in the death rate from heart attacks. And there are two factors, I think, in that. The first of them is that we are living healthier. There's been a drive to eat healthy, and of course the ban on smoking, which some people haven't enjoyed in pubs and public places, has had an effect in that smoking is probably the single biggest correctable risk factor that we can modify.
I mean, can we monitor that? Because, I mean, it's always very confusing when you get figures on smoking. It seems like more young people are smoking, particularly young girls. You know, are you saying there that in the more at-risk factors for any cardiac problems, so those people, I guess, in their 30s, 40s, 50s and so on, it's in those areas where people are actually giving up?
Well, they're giving up more often, absolutely, because the drive is again there to try and lower those rates. And of course, a teenage girl smoking, she won't see the effects of that for a decade, 20, 30 years, and then the trouble will hit. And so the smoking drive takes quite a while to come into the system. That's not to say you should be nihilistic about smoking, because the effect that it has on reducing death rates can occur as early as 6 months. So there's no bad time to stop smoking. You can stop smoking anytime you like.
You mentioned diet as well. I mean, is that then tied directly into the idea that we're more focused than we were on cholesterol levels?
We are, and I think also as our economy's got better, perhaps not in the last year or so, but we've got access to more fruit and vegetables, fresh fish, which is going to change. Which I think the UK diet has changed, hasn't it, over the last 25 years, away from high saturated fats towards healthier options.
Of course, you're absolutely right in all of this. We need to focus on not having heart attacks in the first place. But for those people who do, the recovery rate, the survival rate is what's being cut in at more than half in some cases. What are hospitals and cardiologists doing differently?
We've done a lot differently. I remember when I first started training in cardiology in 1995, the dominant treatment for a heart attack was to give a clot-busting drug, which is great, but actually nowhere near as good as what we do now. I run the heart attack centre at the Hammersmith Hospital. Now, if you're on call, you have a heart attack, it's directly into the cardiac catheter lab, the theatre, where we look at the artery and open the artery up with a balloon and a stent, and we know that dramatically reduces the risk of you dying of your heart attack.
And tell us briefly about this hands-on, hands-only CPR, this fantastic advert that we're seeing on the telly at the minute with Vinnie Jones. But are people getting more aware of those sort of procedures and how effective they can be?
I'm afraid we need to be a lot more aware. Probably the best place in the whole world to do it is Seattle. The whole population is trained in CPR. There are a lot of defibrillators around. And the problem with heart attacks is not making it into hospital and being saved by the cardiologist. It's actually not getting to hospital at all. And that's where the CPR comes in. I've seen that Vinnie Jones advert, and I think it's fantastic. If we can get more people trained in appropriately doing the CPR, the London Ambulance Service, the ambulance services around the UK, fantastic at picking up and scooping to hospital, but they have to have someone who's got an output to start off with.
Well, do you know, they are great figures. Let's hope we can continue to improve over the next decade. Dr. Malik, great to see you. Thank you.